everybody. This is Najib Azhar. Ali DeVry gave a rather long introduction. I was planning to give a very brief one, just to explain that, as you've probably seen from the introduction that Ali gave, I have an engineering background and became interested in the contribution of technologies in healthcare. Got into quality medical systems, medical device regulatory auditing and so on with the European Medical Device Directive and the FDA and so on. And through that I then got into quality systems in healthcare and hospital settings, and thus into DeVry University, which has a healthcare technology and healthcare management program. Well, with my engineering background, kind of similar like Mr. Edward Stemming and James Harrington that you may have heard of, both were engineers and got into quality systems. So without further ado, let me get into achieving excellence, or Ihsaan in healthcare. I am going to go to the slideshow mode now. Bear with me. And there we are. Okay, so the topic, I guess, is of everybody's interest, and that's why you're here. Let me go through a brief introduction of why excellence and performance improvement in healthcare. It so happens that this is a quality system and performance improvement is a subject of almost every industry, but particularly in the healthcare industry, it hits us very close and directly to human life, and it affects any performance improvement or lack of quality can be very critical. Okay, why is it not doing? Well, there we are. So I start with a quote from the Prophet Muhammad, who said that God has prescribed excellence in all things. That is, we all as humanity, whatever we do, we should try to achieve excellence in everything that we do. The impact of striving for excellence through performance improvement, as I mentioned, has a direct impact on human life, as it is in no other industry. And by virtue of its direct impact, the lack of quality in most cases causes irreversible damage. This reminds me that as an engineer, once I was in discussion with a medical doctor, and I said, well, you know, you guys have it easy because we engineers on medical devices need to know the layout and sketch and anatomy of each individual unit, whereas you are dealing with the same anatomy whether the person is from any part of the planet. And he said, yes, that is right. However, you can always revive your equipment from death, and we only have a limited time to do so. So he scored 1 on me on that. Okay, so as I mentioned, and by the way, this was a local guy here in the San Francisco Bay Area, worked with IBM, engineering background, and one of the fathers of performance improvement, organizational excellence in the industry. James Harrington actually mentioned came up with the 5 pillars of organizational excellence, and in particular, the pillars that he mentioned were to achieve permanent change in an organizational setup. The 5 pillars mentioned here are process, project, change management, knowledge management, and resource management. These pillars, like he mentioned, that are not something to be individually treated, but the key is to achieving permanent organizational excellence is actually in managing them together in a combined manner. Also, the application of the Baldrige Award, which is used to be in business, in education, as well as in healthcare. And it addresses and gives points for various categories like leadership, focus on patients, other customers and markets, as well as a section on measurement analysis and knowledge management, and then finally workforce and a result-oriented thing, which is outcomes. We will come across these outcome indicators and scoring system later in our presentation. But this just shows you an overview that there are process items, these structure, process, and outcomes indicators later on in this presentation. But this gives an idea of a point scoring system, and as you see, it's a very results-oriented structure in which results form actually about 45% of that scoring system. So the system is getting a little slow to move the slides. There it is now. This actually shows the various core values that are addressed in business, healthcare, and education. And if you see those, let me get my marker over here. Here. So here you see that community health and patient-focused excellence as compared to customer-oriented, or in the education system, a learning-oriented value over here. Well, the Baldrige Award, as I mentioned, is also given in manufacturing and service companies as well as nonprofit agencies. With that in mind, setting up what are the industry norms and standards of evaluating excellence in the healthcare field, and very similar, like I mentioned over here, to something that is carried on in the business and education as well as manufacturing fields. We will go into actual applications of what are the domains of quality as defined in a healthcare field. Well, as we looked at that last slide, something that is different is the customer is different. And keep in mind, the customer over here is not the customer who's actually shopping around and doing something. The customer is a patient. Many times it's also the patient's friends and family who are associated with the patient. So the customer is a compromised customer in a situation in which they need medical care and so on. Well, what is unique about the customer is that he or she may not be in a state of mind to make the best choice. However, they do make the choice, and that's why friends and family usually accompany a customer, the patient, to a healthcare delivery organization. Now, how would you define the Institute of Medicine actually, considering all the stakeholders in this healthcare system, the facilities of healthcare, the professional staff which staff these facilities, administrators which carry out the administration work, treatments whether through drugs or devices, and then finally the customer itself, the patients. Considering all these, they made a study, a very famous one, about bridging the quality chasm. Whoops. Okay, excuse me for a minute. I should need to go back over here. Yeah, so that jumped a little on me. So the Institute of Medicine report concluded that patient care and treatment, the domains of quality to be addressed, are safety, effectiveness, efficiency. It should be patient-centered, that is customer-oriented in this case. Healthcare should be given timely and should be equitable. I will go into the next slide into the definition of some of these and some additional domains of quality as applied in the healthcare field. Starting with efficacy, efficacy is basically the ability of the science and technology of healthcare to bring about improvements in health. Whereas efficiency, excuse me, guys. Looks like there's a little time delay between that. So effectiveness is defined as the degree to which these attainable improvements are in fact actually attained. Whereas efficiency is the study of actually how to incrementally lower the cost, to be able to lower the cost without diminishing any improvements, or in some cases having improvements with minimal costs. That is the criteria of efficiency. And then similarly, optimality, acceptability are defined over here. Acceptability being according to the expectations of the customers, indicated over here as patients and families. Legitimacy is actually conformity to the local social preferences and any norms, laws, or regulation as they vary from country to country. And finally, equity, which is the distribution of health care with equity in a just and fair manner among members of the population. Looks like it's like 7 a.m. in the morning over here, so my computer light looks like it's still a little bit lazy on me. Well, what are the requirements for healthcare to achieve performance excellence? They have been defined as the following, as you see in here, and we will be talking more in detail about the measurement, analysis, and knowledge management. But you see other factors over here, like in other industries, about leadership, planning, as well as workforce management and process management. I will be, during the course of this, focusing more on measurement and analysis. And basically, you'll find that that's what engineers do a lot. I will follow with a few quotes as well that will indicate that measurement is actually very critical to the process of achieving excellence through performance improvement. Well, here in the United States, despite all technological facilities and scientific expertise over here, it has been concluded that here the healthcare system is actually a broken system. I don't know if that's a surprise to many of you, but that's what it is. And as has been defined by, I do believe that this was the Institute of Medicine. I've been reviewing several things. But they said that it is a system in which very smart people, that is with scientific expertise, are working very hard in a broken system. So even despite these technological facilities and scientific expertise, the healthcare system in the U.S. is falling short in 3 specific categories. In some areas there is underuse, and in other areas there is overuse of either beneficial services or procedures, overuse of procedures that are not medically necessary. And then eventually there are errors leading to patient injury. And the patient injuries of varying degrees. As we go on, we will see some statistics about patient deaths caused by avoidable medical errors. Well, I do believe that the power of the U.S. is in recognizing these problems rather than glossing over them. The first step to improvement is to recognize gaps in the existing situation. So this is what we have in most healthcare delivery systems: overuse, underuse, and as well as errors in the system. Well, the solutions to these 3 actually lie in optimal utilization of resources, so there is no overuse or underuse, and also to remove errors, identification of root causes of errors to effect their reduction or, if possible, their elimination. Now keep in mind that it is root causes of errors because even doctors are very are trained basically not just to treat the symptoms, but to treat the root cause of those symptoms. And that is the same approach that is taken in quality in healthcare systems. Well, so keeping that in mind, we are now going into the science of measurement to assess the success of any performance improvement. So the basic questions to be asked are, for any healthcare delivery system or services, what are they trying to accomplish? What is the goal? And what changes are needed that would result in what they define as improvement? And then finally, once they do that, how are they going to know that that change has indeed resulted in improvement? For this, there have to be measurement. And I will give 3 quotes over here as we go on to make us understand the importance of measurement in a healthcare delivery system. Well, measurement is a critical part of testing and implementing any change for performance improvement. And we need to judge, are those changes actually leading to improvement? Now, as an engineer, I understand, I feel very comfortable with quantitative assessment rather than qualitative assessment. One of my pet peeves is whenever I ask anyone, including my kids, oh, so son, how long will it take you to do this job? And he says, a few hours. And to me as an engineer, I find that very unacceptable because what does few mean? A quantitative assessment, and then usually my son comes back with the answer, I can't tell you exactly. And my response to that is, I don't need to know exactly. If you want to give me a range of numbers, 2 to 4 hours, 4 to 8 hours, that's what I need to know, numbers. So you can have a range of numbers even if you don't exactly know. And then obviously I would like to have that range a narrower range rather than a wide range. So if you say 2 to 12 hours, then I'm a little confused. Anyways, measurement is needed, quantitative assessments are needed. And here I give 3 quotes that really are guiding quotes for me, and as well as should be for anyone who is getting into the quantitative measurements of, I'm still waiting for my computer to respond for those quotes. And Oli, by the way, maybe you were right in these things. Oops, back again. Okay, so here are the quotes. This is Edwards Demings of the Plan, Do, Check, Act fame. And he said, if you can't describe what you're doing as a process, you don't know what you are doing. And you see James Harrington's quote over here, who said, measurement is the first step to control and eventually to improvement. If you can't measure something, you can't understand it. And if you can't understand it, you can't control it. And if you can't control it, you can't improve it. Very nicely said, bulleted point quote, spoken like a true engineer. That's a guideline. There's also a quote here by Fermi. I won't go into that detail, but you can review it when you download this presentation. Okay, so we can measure several things. We can come up with lots of numbers and so on. The point is, we need to make an intelligent selection of these metrics of measurement. So here in the table I've listed 5 types of measurement metrics. And what are the questions to be asked to actually select those metrics? So if you want to know what your current performance is. The question is, how are we doing? If you are setting targets, then you're actually looking at how are we supposed to do? What is our target and goal? If you're comparing or standardizing data, then you need to know comparison with some other person's metrics, and you have to use their metrics to be able to compare to them. And finally, past trends, that is how you have been doing, and then future goals on how you're supposed to achieve an improvement in those metrics. Well, all those questions have other sub-questions, and what you need to determine is what is the measurement that you're going to monitor, when you're going to monitor it, how you're going to monitor it, and then set priorities and select approaches. We will talk about different approaches for assessing performance. And then finally, setting up criteria and standards, and having a system for the whole thing in order to bring about a change. Usually I have pretty much of an interactive system. However, this may be heavy for you to absorb if you haven't had experience in these areas before. However, I suggest that I hope you guys are taking notes on that. Well, many of the things that you'll be seeing here, if you've dealt with quality systems and performance improvement in different industries. Oh, okay. I see Ali's comment over there. I'll try to do that. Oops. Okay. So in the environment of care, you have some peculiarities as compared to other industries. And that's my idea over here, that anybody with either a background in healthcare but not into performance improvement and quality improvement, or someone who has industry experience in quality improvement will see the nuances of application of the same approaches in healthcare. Yeah, I'm afraid my computer has been on for quite some time, so the transition is a little slow in that. Okay, here it is. I was about to switch it to my PDF backup mode.
Okay, it's working fine.
Yeah. Okay. So in the environment of care, there is two things. There is the setting of care, and everybody who's come across as a customer or as a attendant of a patient or a customer can know that the setting of care is either it's an emergency setting, inpatient or outpatient, or others listed over here. Incidentally, the residential and telehealth facilities is very much now the focus of things here in the United States. Getting community health working so that people don't actually need to come to the hospital for a lot of things, and working on preventive care rather than performing inpatient care at hospitals. Then you may define the environment care in what is the stage of care from a particular patient's point of view. Is that a chronic problem going on? Is that an acute problem, emergency, long-term, and primary and urgent, and so on? So again, each one of these is a different management system depending on what is the setting of care or what is the stage of care. Now looking at, every industry has organizational processes, but looking at the peculiar processes that could be in healthcare, there are several listed over here that are very common. And if you have any questions about that, we can do that in the end. But I'm going to focus on the latter few, which is technologies, whether health information or technologies in the form of diagnostic or therapeutic equipment and then finally the quality measurement part of it, which is benchmarking, data, and feedback. By the way, we will come across this feedback issue, which is very, very essential. Keep that in mind. So these are the different organizational processes that you would come across in a healthcare delivery system. Okay, now looking at the quality goals, mechanisms, and different tools. As I said, we will be getting into the tools for these quality measurements and approaches, and try to present briefly. This is, as you probably see, a very, very vast project. I mean, very, very vast topic. And each one of these slides can be the topic of another seminar, so to say. But I will list a few here, and actually the idea is to perk your interest and see what, depending on the interest of the audience, can we go into further details maybe at a later session. So we have two things that we are dealing with: quality improvement, which includes goals and mechanisms, and quality tools, which you're going to look into, which are different topics like benchmarking, patient safety, quality improvement strategies, and so on. This is just to give you an idea about the different issues and different types of goals and mechanisms. For example, one of the goals could be reducing the length of stay of an inpatient. Another goal could be, as mentioned here, patient satisfaction, or quick delivery, as we said, rapid response teams to provide that. Now, let's get into the different approaches. That was about tools. We will come back to tools a little later as well. But we are looking into the approaches to the analysis of the performance of a healthcare delivery system. Now, the same formal approaches to analysis which are in other industries, such as quality improvement, quality assurance, performance improvement, total quality management, and so on, are used. Now, I want to define over here that quality improvement and performance improvement are sometimes used interchangeably. However, some people do define a difference between quality improvement and performance improvement. They differentiate performance improvement as something that is a change in the system performance. And in healthcare system, it is often referring to administrative systems. Whereas quality improvement they define as something from the systems impacting the actual quality of healthcare. Now again, the quality of healthcare is defined in so many different ways, so it actually depends on how you choose to define quality. Again, if you are able to do that quantitatively, that's very good. If not, you'll try to get some kind of hybrid assessment, which is a quantitative assessment based on a qualitative idea. So I'll present over here. Oops. That was a call from somewhere on the East Coast. Sorry about that. The three models that we are going to talk about briefly are the FADE, the PDSA, and the Six Sigma model. The FADE is the focus, analyze, develop, execute, and evaluate. By the way, this evaluate is that feedback part, and we will see that when we go into the detail of the FADE model. And then the PDSA from Demings, who's been credited with this first approach, is the Plan, Do, Study, Act. This may be very familiar for most of you, but we're going to look at some examples from the healthcare field. And then finally the Six Sigma method, and there are several methods in that. One of them being the DMAT model, which is design, measure, analyze, improve, and control. Now, if you see these three different models, they all actually go through a series of things, a series of steps to achieve an analysis of performance. Now, the nuances of the industry of healthcare, I will mention that in a typical industry, these quality efforts are focused on reducing product failures or reducing work-related injuries. Whereas in an administrative setup, the management is focused on either increasing efficiency or reducing rework on something. Whereas in the healthcare, the focus is on actually reducing medical errors and or reducing avoidable morbidity and mortality. The avoidable is the key thing over here. There are some morbidities and mortalities that are not avoidable. We need to focus on what is within control to reduce morbidity and mortality. So as I mentioned before initially, that quality and performance in the healthcare industry actually either directly affects life or the quality of life. So life is addressed in mortality and the quality of life in morbidity. So as you can see here, that if we are the customer or the patient, we want a zero defect or zero level of medical errors, and morbidity and mortality obviously not so. So what are the different types of measurement indicators? They can be divided into either structure, process, or outcomes. And this is like common between all industries, and we will give a few examples from the healthcare industry. So structure is actually something that is mostly physical, either physical human or physical resources, so like buildings, equipment, materials, parts, or so on. Whereas a process is how the system works as a whole. That is, in the healthcare, how is healthcare being provided? And the outcome is the result of the process being used with the available resources in structure. And the outcomes is the final product and results, so that in the case of healthcare, it is the health status of the individual, of the community, of the public, and whether that process did actually make a difference or not. And now we will go into a little details and examples about what are the different, how do we assess these different types of indicators, whether they're structure, process, or outcome. Well, first of all, structure and process are much easier to measure. For example, the resources of what buildings, what equipment, what trained personnel you have is much easier. The process of how the system works, usually there are standard operating procedures, protocols typically in healthcare for different types of diseases, and that is a little easier to measure as well. The outcome is not as easy, but it is the most important. If you need to have a result-oriented system. So let's look at the sequence of things between the structure, the process, and the outcome indicators. So you have inputs, which are structure, and they are the resources necessary to carry out the process, which is going to come further, or a service, or a product from a supplier. So the next step is the processes, which is a series of steps that come together to transform these inputs into the outputs or the outcomes. And that is over here, which is the outputs and outcomes are the services or products resulting from utilizing the resources of the inputs or structure through these steps of processes. This is the simplest model of the sequence of inputs being converted into outputs using processes or a series of steps. Let's look at some examples from the healthcare field. So the inputs would be the people or the personnel. It could be medical personnel, assistant personnel, and so on. The infrastructure, that is the building and access and the equipment and all that, as well as the materials, drugs, information technology, and so on. And then the processes is that what is being done in the healthcare delivery system and how it is being done. Whereas the results would be what are the health services being delivered, what is the change in the system, and what is also the client satisfaction is the eventual outcome. And by the way, this model has been presented by DeVry back in 1980. The system is the same as being followed. You can also have more complex flow of process between that and the content of care being given, and the process of providing care can be either viewed as the traditional quality improvement, which is you have evidence-based cares, standards and protocols, like I said, are followed, and guidelines are followed in the medical field very much and in each specialty. But the process of care, being the quality improvement methodology, can be added on to that to give the continuous quality improvement rather than just the traditional concept of quality improvement. You can even get into more complex interrelationships between the structural indicators, the process indicators, and the outcome indicators, as mentioned over here. And again, there is a healthcare example given over here, the equipment or personnel being part of the structure, the process through which those facilities are being used, and eventually the outcomes like the satisfied patients and so on. I don't have the timer on here, so I don't know where exactly I'm doing in time. I hope it's good.
Sir, you can take another, sir, about 5 minutes.
Okay. I will probably quickly run through something. I was not very sure if I could go into more examples of the tools, but I will flash some of them later on. So we can look at an example of this structure, process, and outcome in an objective being to reduce prenatal mortality in newborn patients. So if you look at the structure, that would be the availability of health professionals. A process indicator would be the percentage of mothers receiving prenatal care, so that's a process. Percentage of mothers taking vitamins, that's a process, the taking of vitamins. And we know that prenatal mortality is adversely affected by smoking mothers, so the percentage of mothers who are counseled to quit, that's a process. And the outcome would be a reduction or study of the indicators of neonatal mortality rate and prematurity rate and so on. So I have some examples here of typical indicators which you can use that as an exercise. For lack of time, I'm not going to go through that, but you can use that as an exercise of these 4-item process indicators to see which one of them is a structural indicator, a process indicator, or an outcome indicator. I will just take one example over here. Again, the key word over here, when we see the percentage of children having received immunization, that would directly go into the process. Now, some of these which are actually processes, you can envisage an outcome measurement to see whether that process has been successful or any change. So here is where I'm actually coming to, like I mentioned, this is a study that was done, I think, in 2008, again by the Institute of Medicine. It's kind of a Pareto chart of the leading causes of death in the United States annually. And you look here, of course, heart disease, cancer, but I want to focus on preventable medical errors. That's about close to 100,000. It's actually 98,000 every year deaths from preventable medical errors. And these are not patient injuries. These are deaths. Like I said, irreversible deaths. Well, keeping that in mind, to me, one of the course that I actually gave in the introduction as well, in the Quran, which mentions that if anyone slays a human being without due cause, it's as if he has slain all mankind. And if you save a life, which is what you do many times in healthcare delivery, so you save all mankind. So we wouldn't like to be part of that 98,000 a year mortality rate due to preventable medical errors. Well, I just want to flash through the models. Again, like I said, each one of these can be the subject of another presentation at a later time. The FADE model: focus, analyze, develop, and execute. And then you can have several sub-steps in that. There is definitely an evaluate, because after you've done those steps, you have to reevaluate. And as we see in the PDSA, the plan, do, study, act cycle, it is an iterative cycle to achieve. So once you go around that once and you go to act, then based on your feedback, you're going to do another plan and actually go through several iterative steps until you reach your target goal. That's the plan, do, study, act cycle from Deming. Then the Six Sigma, which is very common. Again, I mentioned here why the Six Sigma. It's a statistical thing. Standard deviation defined as sigma. Six Sigma would be about 3.4 defects per million. That is about 99.99966%. Is that good enough? Well, it seems great in any industry if it's a product or something. But looking at the volume of people receiving medical care, that's a large number. So, you know, really we expect zero defect over here. The two different Sigma models, I cannot go into detail of that, but these are the define, measure, analyze, improve, and control, and the define, measure, analyze, design, and verify. The two are suited. One is to existing processes, and the latter to new processes or products. This is a more detail about what those two Six Sigma models are and how they are suited to either processes in existence or processes that do not exist and need to be developed. Well, these models that we talked about, this is a comparative matrix about these four models. It's pretty self-evident. Each one of these models actually is going through an analysis, implementation, and review process. And for your particular objective, you have to analyze which one suits you best. There's no cookie-cutter approach to this thing, and you have to be innovative about which process or which approach is more suited to your planned objective. Well, I do have a couple of minutes to present something about different tools, and over here you see several statistical tools, and this is a matrix that actually tells you what are the various steps in the identify, analyze, develop, test, and implement part, and how they're applicable. Different tools over here. You will see a lot of statistical tools, benchmarking, Gantt charts, and so on, and quality assurance, storytelling, and whatnot. Well, I have the last couple of slides, and I was planning to get more time into that, but in the design, measure, analyze, improve, and control, these are the various tools being used in the define phase, the D phase, the various tools being used in the measure phase, analyze phase, the improve phase. By the way, the improve phase has many familiar things for people involved in quality improvement, like the Kaizen, the FMEA or FMECA, failure mode and effect analysis, as well as Six Sigma tools, and you know, based on the Toyota TPC model, the 5S, or as applied in healthcare, they add on a sixth S, which is safety over here, and then finally the control phase. That was rather a short presentation of the thing, of the DMAC model. Okay, I guess I have tried to be within the time. Any questions, comments, suggestions, or whatever?
Well, thank you very much, Dr. Azhar. Folks, if you have questions, you could either raise your hand. I'll be happy to let you speak with Dr. Azhar, and you could either put your questions in the chat box. I see there are already questions in the chat box, so I'll start reading them over. This first one is from Brother Jamal Siddiqui. The question is, sir, how come the lean improvement models are not covered, while it is most widely used methodology for performance process improvement? In US, it is being used by hundreds of hospitals and healthcare networks such as Mayo Clinic, Cleveland Clinic, Theta Care, some of the best hospitals.
Yeah, a good point. Actually, the lean model in healthcare is generally used in combination with the Six Sigma, and as well as the Kaizen model, so to say. I did toy with the idea of making a separate approach to that, but in healthcare, I've seen it usually being used in combination with the Six Sigma. I'm not sure if that answers your question. Yeah, but there's another way of applying the lean model.
Okay, Brother Siddiqui, if you want to supplement it, could you you could put it in the chat box, or you raise your hand, and I'll let you speak with Dr. Azhar. I can move to the next question. Could you give an example of an overuse of procedures which are not medically necessary? I believe there was one of the slides mentioned.
An overuse of procedures would be, let us say that a person has pain in the abdominal area, and I, as the healthcare person, says, "Oh, let's send this guy over for a CT scan." There could be several reasons for that, and a CT scan would be unnecessary use of resources, as well as would be unnecessary radiation for the patient. That would be overuse. I'm not sure if that was your question, if it was answered adequately.
Okay, I guess, so I can move to the next questions because we are running short of time. So there's another one. Patients always want information that allows them to make informed choices about their healthcare services. Is it legal and important in healthcare industry to sharing performance information in public that can also help an organization gain support and funding for its programs?
That is very interesting. One thing I did not address over here, which becomes a whole new topic, is in the stakeholders having what is called patient advocacy groups. And you are right. I don't know. I am originally from Pakistan, and I feel very strongly that if everybody knew what I knew of the healthcare system in Pakistan, nobody would ever visit a hospital. And that's not right either. So I would say to that it should be. Patients have a right to know that. But then is everybody capable to make the right interpretation from that? I'm not sure. But you do bring an interesting point that the customer, the patient, needs to have that information in order to make an informed choice of where they would, if they have a choice, of where to receive that healthcare care. I don't have a complete answer to that, but you're grouping up a very interesting point.
Okay. Another interesting one. For a measurable performance assessment, isn't a metric of quantifiable goals with the combination of attribute skills become a more constructive matrix for measurement?
I'm not sure if I understand that question. Could you rephrase that?
Okay, I think this was from Brother Saeed. Brother Saeed, if you could rephrase it, or you could raise your hand and I'll give you the chance to speak to him.
Yeah, maybe that would be better.
Yeah. Let's move to another one in the chat box. What should be the frequency of reviewing performance in the organization?
Okay, so here's the thing. In any organization, you have to start with an assumption based on some previous records or comparative records. go with that frequency and then reevaluate whether your initial estimate was too high or too low. And then eventually it's an iterative process to get to the right frequency of reevaluating. That is one method, but at the same time, there are certain steps or changes that have inherent, that take an inherent amount of time to have an effect, and that can be used for an initial judgment. But the initial judgment is not it's an intelligent guess which has to be reviewed based on data.
Okay. All right. There's another one. Which accreditation would you recommend to a healthcare organization, such as an endorsement from them shall signify afterwards that our places meet certain performance standards?
Well, there are very few choices in that. Here in the United States, the most popular one being the Joint Commission. I didn't discuss that in my presentation, but they are one of the stakeholders. Again, that is about, in the U.S., about 80 to 90% of the hospitals utilize the Joint Commission for Accreditation of Hospital Organizations. Internationally, they do have a JCI, a Joint Commission International Division. But as far as accreditation, and I'm going to be very candid about this, whether it's accreditation of hospitals or accreditation of educational institutions, it all depends on the accrediting individual. And many times it is possible to pull the wool over the eyes. And I, as an institution, do not just go, yes, for the public, you display accreditation to give them the confidence. But as an institution, do not be satisfied with just simply having that certificate of accreditation. I once, and again, this was in a hospital, I won't mention where, but you can take a good guess, I saw a great big accreditation, and it was actually, the name of that accreditation body was misspelled. And I said, well, that doesn't mean much. But to answer your question, I was going into another tangent over there, but to answer your question, you don't have much of a choice. So just the accreditation is like meeting the minimum standards. If you're running an industry or a healthcare organization or a hospital, don't just go for the minimum. Be the trendsetter, be the market leader in that.
Okay, I guess we could take one or two more questions. To the chat.
I would like to, I think it was Mr. Sohail who asked that question. You can repeat that and I can try and understand, or you can have me with him. But he does have an interesting point. There's one way I understood that. I haven't answered that question yet, so you can give him that opportunity again.
Okay, sir. Mr. Saeed, Mr. Saeed, if you could please rephrase your question. Meantime, let's take, sir, another one.
Sure.
This one I can pick up. Okay, to develop a performance measurement process, how do we evaluate organizational priorities?
How do you evaluate? Now, you know, these are guidelines, and like I said, I mentioned in one of the slides that where I said it's how you decide to define quality. You know, you can either cheat the system and define quality in which you know that you will come up with a good performance indicator, or if you're really genuine to improve the quality, you're going to choose the best possible quality indicator. So here is what I would suggest. Be honest with yourself. The end objective should not be to satisfy the customer to the quality, but to satisfy yourself to the quality, and then automatically you do satisfy the customer.
Okay. We have another interesting one, sir. We see American standards, Western standards of healthcare, etc. Is there any work going on Islamic standards of healthcare?
Well, there is one standard that I mentioned over there, which is from Surah Maida about a zero defect system. If you have caused the death of an individual because of an avoidable medical error, a single one, it is as if you caused the death of the entire mankind. So it is much better than a 6 sigma or anything like that. It's a zero defect system. That is the guideline over there for me. And where if you can think of the hadith of the Prophet, or the reward that you get simply for going and asking, inquiring about the health of someone who is sick, you can well imagine the reward of treating someone who is sick.
Excellent answer. Okay, the last one, Brother Saeed has put a rephrased to supplement what he asked earlier. Let's see if we can try to.
You can repeat his words again, because I will try and understand.
I'll read the rephrased one now. For a measurable performance assessment, does it have to be only quantifiable indicators, or it should also include performance indicators of assessing attributes which are not quantifiable?
Okay, now I think I kind of mentioned it quickly in passing, or I may have skipped it, but I did intend to mention that there are some things that are not easily quantifiable. And one has to be innovative, and one has to use some kind of hybrid about quantitatively assessing a qualitative non-quantifiable quantity. And let me give an example. What I was telling about, this job will take me a few days. This job will take me a few hours. Of course, I would like to have like 2 to 4 or 4 to 8 and so on. But sometimes it is not possible to do that. And we have to use phrases like few. But then we need to define that okay, let's agree that few is something between 2 and 9. I'm not very well versed with the Arabic language, if there's someone there, but I know I haven't heard that, and this was from Surah Rum, where Allah subhanahu wa ta'ala says that we will soon give the Romans victory. And that word used is few, which in Arabic is defined as something less than 9. So that word of few, as long as we can agree between everybody who's reviewing that this few means 0 to 9, and moderate means 9 to 12, and high means 12 to 13, and that way we can at least be communicating and everybody on the same board. So to answer your question, you can have a hybrid or agree upon this range of quantity to apply to a non-quantifiable indicator.
Okay, that really brings us towards the end of the webinar. I know, Dr. Azhar, you have to leave as the new semester has started, and I believe you have a class in an hour.
In about an hour, and I have a half an hour. One of the things I would like to do, Ali, before you conclude, I know this is the first time, but I would like to send some additional information to the people who have registered, so I'll send it off to you.
Sure.
I will send off some thing about the DeVry's healthcare management and healthcare technology management program, and some other resources as well.
Great, and we really appreciate it, sir. I mean, your time. And folks, if you have any more questions, I know people have other questions. You are on your screen. The email address of Dr. Azhar is displayed, so you can always write to him. And we are recording this webinar, and we shall be uploading it on our YouTube channel. And as Dr. mentioned, after receiving the soft copy of the presentation and other relevant information or articles which you deem appropriate, we shall put a complete knowledge pack and will upload on our blog as well. And you all will be intimated with the link. With that, I would like to thank you, Dr. Najib, on behalf of MILE for your valuable time and the absolutely wonderful content which you have shared with our participants. Thank you very much, Dr. Najib.
I thank everybody. It's a little awkward for me in the sense that although I've been introduced, but the attendees haven't been introduced, so I would like to know more, and feel free to communicate with me. I would like to know from what background the attendees were. I'm sure I have lots to learn from them.
Absolutely, sir, and we're going to make it quite interactive, and Dr. Najib will also be initiating a community or practice area on healthcare management on MILE's community. We shall be announcing it very soon, inshallah. So you'll have a better opportunity to interact with him on the regular intervals in future, inshallah. But with that, I would like to conclude and thank you all of those who participated as well. Please be informed that you can always visit our website www.mile.org to learn more about our upcoming programs. There is a high-performing healthcare program is coming in the month of April. You can learn more about it on our website. As I said, we are recording it, and we will be announcing once it's uploaded on our YouTube channel. Once again, thank you very much, Dr. Najib Azhar, and thank you all who participated.
Thank you.
Yeah.